a passionate content creator ready to expand your audience reach? Do you have unique stories, captivating hobbies, or special interests that deserve a spotlight? Rogers TV is here to amplify your voice within the community. We offer you the platform to broadcast your content to a wider audience. And the best part, it's completely free. Don't miss this opportunity to share your vision and engage with viewers. Find out how Rogers TV can transform your content journey today.
You're watching Rogers TV. This program is brought to you by Rogers Xfinity, connecting you to more of what you love. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome as a guest Svet Milanopulus. Svet is a public health inspector for Grey Bruce Public Health, and today we're going to be talking about rabies. And we're also going to be discussing World Rabies Awareness Day. Svet, thank you so much for being on the program with me.
Thank you, Carol.
I know that we've had conversations before, and you always bring so much information to the table. And one of the things that I'm wondering if we could begin with is even discussing about World Rabies Day. My understanding is it's always on the same day every year. If you can maybe talk about it and why the same day, and also there's a theme. So it's over to you, Svet.
Thank you for having me on the show. We have in the past had a couple of segments, and because the health unit covers multiple programs, but for this session we're going to discuss rabies and most definitely World Rabies Day 2025. They began in 2007. And it's always in North America. It's September 28th, the day. That's a little bit of a respect and to commemorate the individual who developed the rabies vaccine. That was Louis Pasteur, the individual who invented the rabies vaccine, and he passed away on September 28th. So that's why the day is picked in North America. Various other countries have different days, but in North America, it's September 28th. Every year, there's a little bit of a theme, and every year it's developing more and more impact. And essentially, the purpose of the day is to bring awareness and to minimize the risk of rabies transmission. Just because in Canada it's a rare disease, it's a rare viral disease. In certain parts of the world, it is close to 60,000 deaths a year take place as a result of rabies. It's one of the most numerous zoonotic disease that is associated with animals, and highly fatal. It's almost 100% fatal, and just because the rest of the world has problems with different species, we have incidences of rabies in wildlife. But this year's theme for the World Rabies Day, it's focused on dogs. Rabies associated with dogs. In some countries, we have even regulations, and we have a multiple agency approach in controlling. So the rest of the world, there's 60,000 deaths a year. In Canada, since we started recording in 1924, there have been 28. And so there's a lot of work that goes in reducing those numbers. Just because we've controlled it to a certain extent, it still the work needs to be done and keep on going so that the animals don't get back. If you remember in 2015, we had an episode of raccoon rabies that was coming in from the States. And so there's a multiple agency approach to controlling these. So this year's focus for the World Rabies Day is proper pet responsibility for dog ownership. That just means individuals have a responsibility to vaccinate their animals. This day brings out the awareness how to minimize the risks, and there's a lot of fundraising in creating vaccination clinics throughout the world. So that is the success of this, and that's what the goal is by 2030. It may seem lofty, but it will require a lot of work to be rabies free in those areas for dog rabies. That's the goal.
Excellent.
Yes,
That-
ma'am.
That's always we need a goal, right? Something to strive for. So my understanding, correct me if I'm wrong, is that the theme for World Rabies Day is Act Now, You, Me, Community. In other words, it's all of us together to make a difference. Is correct? But the theme
That's
changes
correct.
from year to year.
That's correct.
Yeah.
And that's an approach that we take here as well.
Yeah.
Much like Act Now for the individual, Act Now for the community, and then that involves regulations. Like in the vaccinations, we don't have so much of a problem with stray dogs or stray animals. And that's where the problem is in these areas. And the community level could be the governments and the regulations. So as of 3 months of age, it's law in Canada to vaccinate your pet, your dog, your cat, your ferret, animals that go that interact with like petting zoos, for example, cattle, horses, sheep that interact with people. They're required to get vaccinated. Livestock, and also Ministry of Natural Resources does baiting for wild animals. So that is a component of the community. Not only the regulations, but government agencies are actively vaccinating not only domestic animals, like pets, cats, which is law, but now that's how we controlled the raccoon rabies when it came from New York. From the States. And the baiting is effective way. They drop it from the planes. They fly really low to the surface, and then the raccoons, foxes, skunks, and are an effective way of getting vaccinated. Yes, ma'am. So there's a lot of work that goes behind the scenes in keeping these deaths non-existent. But there's a lot of anxiety that is associated with it because of the fatal nature of the disease.
Let's talk a bit about the disease, Svet. Now, you've told me, and it obviously is a whole community approach. It's public health, it's bylaw enforcement, it's a vaccination clinics. So it takes everyone. But my understanding from the information is that this disease is 100% preventable, but it's not really treatable. It's a very dangerous disease. So I wonder if you can talk about what rabies is and what people should be on the lookout for, and then why it's so important that people pay attention to the health public health releases about dog bites and why that's so important. If you wouldn't mind taking
Yes,
us through
ma'am.
that. I know that's a big package of
It's
information.
okay. Yeah, we can. I'll try to do it step by step. And if I go on a tangent, try to reel me in. So indeed, some not only do vaccinations and responsible pet ownership, like making sure that your dog is on a leash, go a long way in reducing the incidences. But every time an individual gets bitten, scratched, and goes to the doctor, it's a communicable disease, so it gets reported to the health unit every time there is a biting incident. So, and then we follow each incident to make sure that there is no risk of rabies transmission from a biting incident. So that goes. We follow in 2025, we had in Great Bruce Public Health has investigated over 900 animal exposure reports
Wow.
where an individual is either bitten by a stray animal, a domestic animal, bats, or various other. So 900 episodes that we have investigated. To put that in a little bit of perspective, in 2023, it was slightly over 500. So there's a lot of awareness that is being brought up to the level that our work gets inundated as well. Even though it's a rare disease in Canada, the amount of time that goes into making sure it's a rare disease has to be acknowledged. And the investigations, whenever there's a biting incident, we want to confirm that the animal involved in the biting survives a 10-day period. If they survive a 10-day period, that's the follow-up that's entailed. If they survive a 10-day period, that is 100% indication whether that there's absolutely no risk. If the animal that bit was rabid at the time of the bite, they don't survive a 10-day period. They will become ill within 5 days and pass away by day 10, making the investigation simple. But sometimes it's very complex because the ownership of the animal, sometimes it's hard to know. Sometimes these biting incidents happen on a trail, and the person that got bit doesn't record, oh, who's the owner of the animal. So that is why it's important, like you said, to be aware of the media releases. That's when we send out a media release, we're having a difficult. It's a little bit more complex in finding the animal that did the biting. So if we're able to follow it up with that investigation, individuals do not have to go through rabies vaccine. And let me backtrack a little bit. An individual is at risk of acquiring rabies if you're in contact with the saliva of a rabid animal. So the saliva has to enter your bloodstream. So it's traditionally through a bite or a scratch, but you can also introduce the saliva of a rabid animal through mucous membranes. If it goes in your eye, in your nose, in the mouth, then it's an introduction. It counts as exposure. And it's, also, if it doesn't necessarily have to be a bite, sometimes we have cracks like open wounds, and then if saliva goes in there, it becomes an exposure, and we will follow it up. So every time that an individual is concerned or they think that the best thing to do is to wash the wound for 15 to wash the wound and flush it to make sure that the saliva is not entering. That's what we're doing, and then go to a physician if the incident broke the skin. Not the family doctor will will inform the health unit that there was a biting incident, and then we do the investigation. And not only do the investigations increase this year quite drastically from a certain level. Also, our rabies vaccine distribution has increased as well. And I just wanted to point out in 2023, there was just over 70 vaccine deliveries for rabies, where we were not able to follow up with the animal. And then we make the doctor orders the rabies vaccine, and then we deliver it. So in 2023, there was slightly over 60 deliveries. This year, we have already 150.
Wow, that's significantly increased.
That is a significant increase, and there's a significant increase in the investigations as well. And that goes to show you the awareness and the information that health units and multi-sectoral, the Canadian Food Inspection Agency is responsible for the testing.
Yeah.
So we follow up human exposures. OMAFRA Ministry of Agriculture follows animal to animal exposures. So we're well managed, and it's highly from a federal, provincial, everybody plays a role. Not only that, but we are regulated to vaccinate our animals. We are leash bylaws, absolutely, and there's a lot of duty to report. And that's our success. We follow each and every one because it's a fatal disease.
Yes. Now, let me ask sorry to interrupt, Svet, just a couple of questions. Would a dog owner be hesitant to admit their dog bit someone because they would be concerned that for some reason they might get into difficulty? Do you ever have that? And
yes, ma'am. There is a trepidation. Some people have that notion that something's going to happen to the animal. Public health is going to take it away. Animal control is going to take it away. And that is not the case. The interest of public health is to follow up infectious diseases. And if we allow the individual to put the dog in this scenario under an observation or a confinement period within their own home, if they're able to do that, and then we follow it up 10 days from there. So people sometimes, because of the nature of public health, sometimes people think that we go right to the most severe. No, but it's actually, we just want to ensure that 10 days we can ascertain whether that dog is still alive. But yes, ma'am.
So in this day and age, sometimes with finances, it's difficult for people to get their animals vaccinated. We're supposed to, it's regulation. But what would happen if somebody was really struggling and and the idea of a vet or vet clinic, there is a cost. What's out there to help people who might have some financial challenges with this?
Perfect answer and a perfect question, because there is help associated with it. Much like the World Rabies Day, they fund some of these clinics around the world. In Canada, in every geographical area has rabies clinics that we in Owen Sound. We have them in September. The Owen Sound Animal Shelter actually hosts it every year. So those clinics at a reduced cost. So I believe it's under $30 to get as opposed to a full physical and that process with the vet. So we want to reduce the barriers
Yes.
at all times, and that is one way to do it. And if it's you don't have to wait for a certain day, the health unit also has partnered with several vets in our Great Bruce counties.
Mhm.
Um, and we have a voucher as well to facilitate, because when we do the investigations, not only do we want to find out that the animal survives a 10-day period, we want to ensure that we
Yeah.
work with the owner to say, when can you get this vaccinated and how can I help if there is a financial barrier?
And
Absolutely.
that's really important for people to know that there is help out there, and for sure, for everyone, for the pet owner, for the pet, and also for the individuals generally in the public. Everyone is safer because of this. Um, Now, what would you say to an individual who maybe the skin wasn't broken and but like you've indicated that they could still be at risk, but they say, well, I'll just wait and see if I'm going to get sick and then I'll go to the doctors. What would you say to someone?
That is, you can't wait and see for symptoms to develop.
That's enough.
So that's a no-no. It is all the rabies is preventable
Yeah,
by not being exposed to the saliva of a rabid animal. But if you are exposed to the saliva, uh, individuals do not have time to wait for symptoms, because once symptoms appear, that's when it's fatal.
yeah,
So in that's why you would not encourage that approach, but you would encourage them to go see a family physician.
yeah,
And then it gets reported to the health unit, and then we would do a risk assessment.
yeah,
And if that animal cannot be followed up for, we will err on the side of caution and vaccinate the individual prior, because that's the only treatment prior to the symptoms. If you get inoculated, it's a series of 4 shots. It's a regimen that you have to follow, but you have to get those shots before the symptoms appear. And the incubation for rabies virus could be anywhere from 2 weeks. The earliest it's ever been reported, 2 weeks, most of the time up to 6 months, but
oh
it
my
could be
goodness.
it could be up to a year.
Wow.
Depends on where the wound is.
Yeah,
So if you got bit in the finger, the virus travels. It has to go to the neurological system, and once it reaches that, then the symptoms appear.
yeah,
So if you're bitten on the finger, you have many more days to go see the doctor, as opposed to if the wound was on your neck or on the face. Then because the virus travels a little bit each day. So absolutely, if you have if the incident is a bite or a scratch or mucous membrane, um, definitely.
yeah. Really, really critical. So it is a neurological condition. And what I'm hearing you say is once the symptoms come, it's fatal. There's nothing, no treatment at that point.
There isn't.
That's a bit
All
scary, Svet. I have to tell you, that's a bit scary to
yes, ma'am.
think that, that could happen. And like you say, over 60,000 deaths can occur
Right,
through, and
but
so it is
I,
risk.
yes, ma'am, there is a risk, but I do want the viewers to there is that risk and there is that anxiety, but the wealth and resources that go into investigating and following up these incidences have should reduce. That's why it's a rare disease in Canada,
Yeah,
but we can't stop doing this work.
for
Um,
sure. For sure.
but don't just be anxious. You do have to be exposed to the saliva. So
Yeah,
sometimes the anxiety, especially with the bats,
yeah,
because they have fine nails, they have fine teeth. Um, it, there's a lot of anxiety with that species.
So you've explained what people should do if they think that they have been exposed. Anything else that people should do to um, protect themselves from rabies? Anything we haven't discussed?
The Protect your pets,
Okay.
because your pets will. That's the only way that they will encounter rabies in Canada is through a fight with a raccoon or a fox.
Yeah.
Um, so in Ontario, as of July, there were 6 foxes with rabies.
Yeah.
There's been several bats that have tested positive. So it's endemic. We know that it's here. That's why vaccinate the pets.
Yeah.
Protect them, and then you're protecting yourself. So it's a multiple barrier approach.
Yeah.
Vaccinate your pets. If they're unfamiliar animals, do not go to strange animals to pet them. Um, do not stick your. A lot of incidences happen when people are going to the grocery store and they see a dog in the car and they want to pet it. Don't absolutely sick or injured animals. Don't handle because they will bite if you touch them in a sore spot. How many people want to help? And
Yeah.
there's biting incidences that way. So protect your pets, protect yourself by not approaching sick or injured animals. Keep your pets indoors. Bat proofing houses. If there's an entry level to do it that way. If the bat comes in inside the home, when you're trying, if nobody's come into contact with it, we're not at risk, even though it's a known culprit. We're only at risk if you come in contact with it. So if you want to open a window, let the bat go out. If you haven't come in contact, if you are so inclined to take leather gloves so that it doesn't puncture, even if you handle it. So those are essentially the steps. And then, like I said, with Ministry of Natural Resources, so we're protecting people, we're protecting domestic pets, and then we're going to the population with the wild animals as well.
Yeah.
And yes, ma'am.
You know, our time always goes so quickly when we have this conversation. And I always say to you, it wouldn't be about being in the house with the bat because I'd be out of the house before the bat could exit.
Right.
Because it is critical, but obviously ensuring that you're protecting yourself is absolutely critical. So Svet, it's really important for us to recognize the contribution of public health towards keeping our community safe. And I want to thank you first for sharing all this information, but also for the work that you do on a regular basis to follow up, to make sure that everyone is monitored. And I can't believe that our time has passed already. I want to thank you for being here on the program, Svet. It's always a pleasure to speak with you, and especially about these important topics for sure. Thank you.
Appreciate your time, Carol, and anything to bring awareness and safety. Absolutely. Thanks again.
I want to thank our viewing and listening audience as well for joining us today for HealthLink. We want to encourage you to join us again to learn more about programs, resources, and services available to you and to your family. Take care and stay safe.